Family Dental, and today we're going to be covering one of the questions that I get a ton at our practice. Today we're going to be talking about dental emergencies and specifically about toothaches. This is a very common concern that a lot of people have, and it's one of the main reasons that people come to the dentist if they haven't been coming for a long time. So it's a good idea to learn some of the things that we can do to help you treat it and some of the things that you can do at home as well. So let's take a look. So dental emergencies can definitely be very scary and unpredictable. I tell my patients a lot of times they can come out of the blue. It seems like they always tend to hit at the worst possible times, on a Friday night, or they can hit on, Christmas Eve or some other time. So with a little bit of knowledge, we can help you get through that. And I'm certainly sorry if you're dealing with that right now. We often see generally three common types of dental emergencies. We see a toothache, a swelling or an infection, or a broken tooth. And today we're going to be talking about just the toothache. In this case, the nerve of the tooth has died, and that's what's causing your pain. So let's step back for a second and talk a little bit about the stages of tooth health. And I really try to break it down and make things simple so it's easy to understand. And when I think about it, I think about a tooth as going through three different stages. One is a tooth that's healthy and alive. It's generally what you think of with your teeth, not a lot of issues that you're having with them in general. And then the next two stages, where the tooth is inflamed and maybe dying, or the tooth has died, are the issues or the areas where people are really having a lot of discomfort. And so we're going to be talking about the tooth that's inflamed and maybe dying, and sometimes can actually get better, and we'll talk about that, or where the tooth has completely died. So when a tooth is alive, you may notice that the tooth is sensitive, and that lasts for less than a minute or so. And it does not wake you up at night. So a lot of times people come to me when they're getting their teeth cleaned and they say, "God, I have this tooth that's really sensitive." And I'll ask them, I'll say, "Are you worried that there's something wrong with the tooth, or are you trying to get that tooth to not be so sensitive?" And in general, people just want to make sure that a sensitive tooth doesn't have anything wrong with it. And ironically, a tooth that is sensitive is a sensitive tooth can be a sign of a healthy tooth. So a healthy tooth, if you get something hot or cold on there, or cold, you blow some cold air on it, you'll feel some sensitivity for a few seconds, but once the cold water, the cold air is removed, that typically goes away. A lot of times people can treat that with some Sensodyne, or we've got some desensitizer in our office that can help make that go better. But generally, the sensitivity is not a cause for worry and is and ironically a good sign. So let's talk about the next when it's, if the tooth is, let's talk about this for a second. If the tooth is alive, but it still hurts, it may be bruised or a cracked tooth. So sometimes you may have a tooth that's alive, but there may be some other things that are going on beyond the sensitivity. So the tooth, let's say you bit down and you bit down the tooth really hard, either on the fork or a piece of bone in the food, and you can hit that tooth really hard. The tooth can get sensitive or sore when you're chewing on it, but generally this is a sign of like a bruised tooth, and so that can get better. So I'm a little bit less worried about that. And a cracked tooth is another issue altogether, and we will talk about that in a different video. So let's talk about when the tooth is dying. So these are some of the symptoms that you may have. You may have, this tooth may wake you up at night, so it's a common symptom. So it starts to throb, or it feels like a heartbeat in the tooth. It kind of beats on the inside of the tooth. So that's definitely a concern. And you may have some, it's that sensitivity that we talked about before, you may have some lingering sensitivity. So this is a good differentiator. So let's say you're drinking some cold water and that tooth really starts to throb on you and bother you for longer than a minute. So you drink the water, the cold water's out of your mouth, and then 2, 3, 4, 5 minutes go by and you're still feeling the tooth. That is a sign that that tooth may be dying on you, and definitely a cause for concern. Some of the reasons that might happen is you may have a cavity that's gotten really deep into the nerve of the tooth. But oftentimes these can come up out of nowhere, and maybe you had a crown or filling done years ago on that tooth, and now it starts to bother you. There's really no rhyme or reason for it. So that's why it can be a little frustrating as well. So will a dying tooth ever recover? So there are some instances where a tooth can become inflamed, and it will start, it will have some of the same symptoms. It might be a little bit lingering to cold sensitivity, but let's say you just had a large filling done on the tooth, and sometimes that can get better. So it is something that kind of monitors. So that's something we can certainly help you with. Well, let's take a look at when a tooth has actually died. So if you look up here on this x-ray on the upper right, you'll see an area here where it's darker around the root of the tooth. This is a sign of the infection inside that tooth. So when a tooth has died, it's become infected, and it is not hot or cold sensitive anymore. It may still wake you up at night, but more to the chewing sensitivity, and it may be tender to the touch or chewing. So what's happened is that the nerve and the blood vessels that are on the inside of the tooth, they become so inflamed that they're no longer alive, and that dead tissue on the inside has created an area of infection for that tooth, and you'll start to get some swelling on the outside, and that swelling is what is tender. So if you imagine if you're chewing on this tooth and you have a swelling around the end of that, then it can put some pressure around that tissue, and that's what hurts. A lot of times I'll make the analogy that if you got an infection underneath your fingernail and you pushed on that, it's so tight and tender that that is a similar analogy, and it can hurt there too. So when you have a toothache like this, we want to focus on first getting you feeling comfortable, so alleviate your symptoms, and then removing the infections. So sometimes I'll have somebody come into the office and they have a really bad toothache, and one of the things we can do is even get them numb that day, because what I'll find is people, they haven't slept very well that night before, they maybe had not even slept for a couple of days, they haven't eaten very well, or they haven't had much to drink, and so they're just in general not feeling very well. So if we can get them comfortable that day, then they can start moving the process of feeling better. And that's just alleviating the symptoms, and then secondarily remove the infection. So how do we do that? So in the short term, above and beyond getting somebody numb, one of the things we'd want to focus on is if we can't focus on the long-term treatment, then get somebody on some antibiotics. The antibiotics will start working to get that infection under control and start feeling better. And if you can take some pain medication, whether that's ibuprofen or Tylenol, sometimes that can make a big difference as well. Also staying hydrated and trying to get some sleep. And then when it comes to the long-term solution, what are you going to do for a tooth that hurts? Really, you have two options. In the end, you're trying to get the infection out of the tooth. And so there's two ways of doing that. One is to take the tooth out entirely, which is the extraction, or we can do a root canal on the tooth. And a root canal is make a small hole in the biting surface of the tooth and remove the infected part of the tooth and seal that back up. And I know that root canals have a really bad reputation. Sometimes people will say, oh, this is worse than a root canal. But root canals are really designed to get you feeling better in the long run. So those are some long-term solutions for you as well. I'm sorry if you're having a toothache. I know that can be a real concern, and is obviously something we deal with all the time. So if you have any questions or concerns, give our office a call, and we can certainly work to help you out. All right, thanks.